All right, folks are still joining us, but let's begin. We have so much to discuss today. I'm Grace Rubenstein, Editorial and Communications Director at HealthBegins, and it's my privilege to welcome you today, this morning, this afternoon, whatever it might be for you, to our conversation concluding 2025 just about on rest, resistance, and hope. Um, just a few notes about how this is going to work. This is a slightly different conversation than our usual webinar. Rather than presenting information to you, as we often do in webinars, and having a conversation on the side, the conversation is front and center today. It's the main event, and we're really looking forward to digging into it with you. So there'll be a conversation going on among our panelists, and we'll be asking questions for everybody to think about. If you have comments or questions of your own to add, please, by all means, add them in the chat that you see on your screen. In fact, let's get that going with just a little test run here. So if you could find your chat panel and the icons along the bottom of your screen, and then just type in your name, where you're calling in from today, and your organization. We'd love to see who's joining us. Here's a little demo. I see my colleague Vince. Um, hello, Melissa. Let's see. My goodness, they're coming in fast here. Virginia, Colorado, Louisiana. Our guest Jeff is in Louisiana today too. Pennsylvania, Washington, Chicago, Nevada. Wonderful. Thank you all very much. Keep it coming. So your lines are all on mute today. So a lot of our conversation is going to be happening in the chat, but as you'll hear more soon from Sadhana, we will have opportunities for a handful of participants today to come on and share their thoughts out loud. So what will happen if that is the case is you'll just get a little note from me asking if you would like to join us, and you can let me know yes or no. And if you are going to join us, we'll just take you off mute for the moment. For the rest of the time, all the other participants' lines will remain on mute. So we'll be talking and having an exercise brought to us by our guest, Jeffrey Ring, for about an hour. We are recording this, so don't feel that you need to be writing things down necessarily. We'll be sharing the recording with you later. That allows you to be fully present for this hour. And we ask that you please bring respect and curiosity and perhaps a bit of joy to this conversation. So next, please. Thank you. Our objectives for today are hopefully that by the end of the webinar, you will have a chance to reflect, breathe, and rest with a community of fellow health equity champions here today. That you'll have the chance to honor the power of shared action, resistance, and the importance of our collective efforts to protect communities and vital institutions, and that we will all together build resilience, solidarity, and resources to protect democracy and health equity in the year to come. Next. With that, and thank you, by the way, to my colleague Bobby for running the slides. I have the honor of handing this over to HealthBegins Managing Director, Sadhana Devaraja.
Thanks so much, Grace, and thanks everybody for joining us here today. We're so grateful to be in this community with you really every day, but kind of live here on the line. As Grace mentioned, this is a little bit of a different webinar. You know, if you've joined our webinars before, if you know who we are a national mission-driven consulting firm, and we're a field catalyst, really. We try to help move the conversation as well as the actions forward to help all healthcare stakeholders, largely Medicaid serving ones, exceed health equity and social needs requirements, and really shift the conditions that enable us to do the work that we want to see and the outcomes that we want. Practices. These are just some data points of how we've been able to do that. One thing we always share on these webinars or conversations is our work, how it's observed, how it's led by key observations, if you go to the next slide. And it's, I think, more important than ever to kind of spend just a moment to say these out loud together, almost like a mantra at this point, which is that health and social inequities are experienced as social arrangements, including structural racism, put some people in harm's way. One more click. Equity is not just the absence of harm or unjust differences. It's the presence of systems that promote and preserve healing, opportunity, and justice. Since structural violence and harm is spatialized, institutions need a portfolio of strategies to advance health and social equity that's place-based, outcomes-focused, and works across levels of change across individual all the way through societal. And courageous leaders, like the folks that regularly join our convenings, our partners, our clients, our peers, our friends, courageous leaders like you need support and solidarity to implement these strategies and to transform your institutions, your relationships, your communities, and yourselves in the process. So, with that kind of backgrounding in mind to who we are and how we approach that work, we want to go into this conversation today, which we really structured, like Grace mentioned, in a different format. This isn't our traditional webinar. As the year was closing, we heard from a number of you that you wanted to be in a space to kind of really rest, to honor some of the shared action and resistance that had taken place over this year, and how it had left some of us feeling exhausted at times, energized at other times, and kind of draw from that communal experience to build some resilience and solidarity for the year to come. And so that's why I'm really thrilled that I'm joined in this conversation by HealthBegins CEO Rishi Manchanda, as well as our dear friend Jeffrey Ring, who has joined us in the past, has been a friend and a compatriot for years now, I would say. And I'm going to invite Jeff to lead us in a grounding exercise, which I'm personally really thrilled to be on the receiving end of today.
Well, thank you so much, Sadhna and Rishi and the Health Begins community. It is so nice to be with you in this shared space. And thank you for all of the work that you do, providing true leadership illumination and vision for another way forward. Sadhna, you use the words courage and solidarity, justice, community, and resistance. And whoa, when a webinar begins with those words, I am all in. So I'm so happy to be here. I'm speaking to you today from New Orleans, and from my hotel room, I actually can hear jazz music from the street. It's like wafting up and coming into this space and into this space. And I mention that because oppressed communities that have been the focus of systematic racism, um, have found lots of ways to endure, and arts and music, religion, spirituality, ritual, all are parts of that. So you may not be able to hear the music exactly, but I want you to know that music is here. It's all here. One of the best ways, at least for me, to reset my nervous system when I have been rattled by the events of my life or the world around us, is to go inward. And I'm going to invite you now, if you would, to go inward. So maybe you want to close your eyes or cast your eyes downward. And just for a moment or two, we're just going to sit and not do much else. Well, we're going to sit, but we're going to pay attention to the act of sitting. And in particular, the support for your physical body. So I invite you to just notice the support at your back, the support of your hips and thighs from your seat. If you can reach and it's comfortable, maybe you want to see if you can have your feet grounded, nice, solid on floor, earth, ground below you. And perhaps your arms are supported as well at lap or armrest or table. So for now, we're just sitting and observing the act of sitting. And we're taking a little cool inner itinerary tour through all the parts of our body that are supported right now. Back, thighs, legs, arms. For in this moment, you need not walk or carry or attend to things pressing. In this moment, I invite you to just feel the support and maybe even a sense of melting a bit into your chair. Maybe a sense of gratitude. Thank you, chair, for holding up my weary bones and muscles. I will just let go. And one nice way to let go, I invite you, is to just let go of your jaw. Let your lower jaw just go slack. Notice what that feels like. And notice what happens to the next breath when you do that. Maybe you want to kind of play with it. Maybe you tighten your jaw a little bit and then just let it go slack and notice the next breath. For me, the next breath is delicious and fantastic. It is somehow deeper or more fulfilling. It's as if that next breath has just been waiting for me to let her in. So what are we doing? We're sitting, we're breathing, we're letting our jaw drop. We're noticing the ways and places that our physical body is supported. Maybe you're noticing the gentle rise and fall of your chest with each new, welcomed breath. Now, I know you know about the two main components of the breath cycle, the inhalation and the exhalation. But I'll remind you that there are actually at least four parts of the breath cycle: the inhalation, and then this gentle, sweet, hidden, delicious pause before the exhalation begins. And at the bottom of the exhalation, sweet, delicious, hidden pause before the oxygen rushes in anew with the next inhalation. So I'm going to invite you to breathe. And as you do, just really notice all four parts as you can. And even more, I'm going to invite you in those little precious spaces between inhalation and exhalation. The invitation is to linger and luxuriate just for an extra beat or two in those transitional liminal spaces. And now you can kind of let go of all of that breathing and pattern. But I'll remind you that finding those pauses can be very awakening. Finding those pauses can be very helpful, even in the middle of a spicy or difficult conversation. There are some that say that the The pattern of breathing where the exhalation is longer than the inhalation is really delicious for calming the nervous system. Let your jaw go slack. I invite you to flutter your eyes open and come back into our shared space. It's like to look up and down in a gentle neck stretch and maybe over each shoulder if you're feeling that. And then just a moment to check in with yourself. How are you feeling right now? How are you feeling in terms of mood, emotion? How are you feeling physically? How are you feeling energetically, spiritually, perhaps? Just a brief reflective moment to check in with yourself, a kind of inner thermometer of sorts. And if you're feeling it, I invite you in the chat box to just name a couple of the feeling descriptors that you're noticing at this moment within you. And as we take a look at those responses, cozy, tension released, grounded, open, calmer, tension released. Well, that is fantastic. We just have been playing in this space for a couple minutes. And the impact on our physical body and emotional wellness seem to be rather tangible and precious. So thank you. Thank you for joining in. And I will turn things back to Sadhana and Rishi. Hello.
Thanks so much, Jeff. That was really beautiful and definitely needed. The word I put in was gratitude. And it was really both towards my chair and the ground below me as you invited, and also for you for leading us through that. So thank you so much. I'd like to welcome Rishi also into the conversation. Hi, Rishi.
Hi, Satha, and hi, Jeff. That was great. Thank you so much, as always, friend.
So as we mentioned, today is a little bit different. And by that, we meant we have questions, some that we've created for each other, meaning for myself, Jeff, and for Rishi, and some that we've created for also the folks in the room. So I loved that invitation, Jeff, of asking folks for how they're feeling in this moment. Hopefully it got folks queued up for that chat box, because we really invite you to participate here and to join this conversation. So with that, maybe I'll just kick us off for our first question, which really takes this beautiful moment that you've created, Jeff, of like shared rest, shared reflection, and asks folks, what are other shared spaces that were meaningful for you? And maybe share examples of shared action, maybe examples of collective efforts, examples of resistance that folks engaged in together this year that inspired you. And so as we, invite folks to answer in the chat, and thanks, Visam, for placing that prompt, maybe we could take a turn of that ourselves. So I'll ask Rishi first. Examples of shared action, resistance, or collective efforts that inspired you or that you engaged in this year.
Thanks, Alana. I'm still in and wanting to stay in this kind of space that we're in now, and I think in some ways this itself just represents a collective action, a way to be able to um, rest with intention as part of a broader collective strategy, right? To regenerate um, our solidarity and sense of commitment to one another. Some we know on the line, some we don't know, but share values with. So I just want to say, first and foremost, this for me represents a really beautiful example of kind of a collective action. And there's so many other examples that I've had the privilege of witnessing, both in our team as well as in other spaces that we have the privilege of joining, um, where I've seen these small, beautiful examples of collective action. So there's been a lot of examples like this that I'm reminded of because of what we just went through in the past few minutes, Jeff, with your facilitation. There's also one other example that comes to mind. I'm here in DC right now, and just came from a really invigorating day meeting with folks as part of a coalition called the Common Health Coalition, which I highly recommend to folks who are curious and interested in learning about how to bridge healthcare and public health. And I was reminded in that meeting yesterday of the work of folks across different states in the past several months to be able to um, step into a certain vacuum, into the breach where, because of what's been happening at the federal level to public health institutions, states have stepped forward. The West Coast Health Alliance was formed a few months ago between California, Oregon, and Washington State to coordinate public health policies and ensure that scientific integrity would continue to shape health guidelines, especially for vaccines. They're not the only alliance. There's regions in different parts of the country that have done the same. And in part, inspired by that, there's a new Governors Public Health Alliance that just formed recently as well, which represents governors from a variety of states and rural, urban communities and red and blue backgrounds. Those are really important forms of collective action, and I think just as meaningful as some of these intimate and necessary kind of spaces like we have today. So that's an example that comes to mind, Sally.
I'm wondering, Jeff, if you've had some examples that are coming to mind for you.
This year, I attended a gathering in downtown LA, and the speakers were Alexandria Ocasio-Cortez and Bernie Sanders. And they spoke a lot in really strong and powerful ways about income equality and income equity, and all of the negativity that flows from these kinds of uh, economic hoarding of sorts by some. And the thing that was so extraordinary for me was, one, how many people were there, but two, how many faces of youth were there. Now, this is kind of always easier for me as I'm older and older. Everybody's younger and younger, but that was even more unique to me. Like it filled me with hope and possibility to see so many young people gathered together in community in downtown LA on a bright and sunny day and yelling, thinking, talking, sharing inspiration for a different kind of world, that we do not have to do things the way we have always done them, and that justice is really a foundational value of our nation. Um, we have swayed from that many times, but it's still there, and we have work to do, but to do it arm in arm. So anyway, that is what's coming up for me as a really quite delicious time together this past year. How about you, Sadhana?
Yeah, I think for me, it's similarly being in person. I think both of you kind of got to that with others that are finding ways to fight the good fight right now. And for me, um, in addition to, I think the colleagues we have at Health Begins and the work that we're able to do here, my local rapid response group has been a really beautiful kind of source of strength for me. And it's comforting to know that these are neighbors. They live next door to me, and seeing the way that it's really um, expanded to be a lot of different things over this year, and LA, we were hit by the fires at the beginning of the year, and that really transformed a lot of relationships here, right? Like folks moved away, our kind of community strings, small businesses closed. Like there was a lot of restoration that had to happen at the same time that everything was happening nationally. And so this rapid response group became a source of strength for fire relief. It became a source of strength for protecting against any sort of unwanted enforcement that was happening. It became a way for us to learn how to engage in city council meetings to get the flock camera contract kind of canceled or not renewed, at least, is that's what we're working on. It became a source for when SNAP benefits were cut and in jeopardy, we were able to come together. So I think there's been something really beautiful about being in spaces near real people that you know, that provides this like psychological safety for me, and I'm really and inspired. Um,
There's another one, Sadhana, that comes to mind. I was just thinking about that as you were sharing. Earlier this year, I received some really great kind of feedback from a number of folks that work in different health systems, from large kind of health systems to community clinics, and it was notes of kind of gratitude for some of um, uh, the ICE cards that we put together. Some information that we put in. I think I can probably drop the link in the chat for these cards. These are the cards that helped healthcare institutions who were struggling to adapt practices to comply with the federal requirements, especially July HHS guidance that many may recall, that blocked health centers from using federal funds to serve non-citizens. There was this concern and confusion among so many about what that would mean, especially for immigrant communities. And I think that combined with a lot of concern in a lot of immigrant communities about what it would mean, right, to be able to just be able to do right by the people that our families, our neighbors, but also colleagues and people we serve, as well as ourselves. It became really important to kind of share that information. And I just wanted to, I think I'll put the link in the chat. It's a long link there, but I think I found the right one. It's just those ICE cards were um, among many resources that were coming out from incredible organizations, some of which we highlight in those cards. And I just wanted to highlight that because that was a real moment that illustrated how being able to provide facts based on uh, thoughtful analysis of the law and of regulations and policy, and be clear and succinct enough to communicate those facts in a way that could be useful to folks. More now than ever, acts like that, whether it's from us or from many other colleagues and partners who have the privilege of working within this ecosystem, so many of these, and so much of this moment is defined by so much confusion and fear that puts a premium, therefore, on just a clear, distilled set of facts based on clear analysis and presented in clear, succinct ways that can provide people with a sense of answers to the big question, what do I do? What can I do now? I just wanted to illustrate that because so many folks in so many different sectors and so many different challenges, I think, have been experiencing a lot of confusion and fear, and it just underscores the importance for fact-based analysis and for succinct, actionable resources.
So we should have a follow-up question for you about that. And thank you for sharing that. You started by saying that you received some really useful feedback about those cards, and that an important part of that feedback was gratitude, that people were expressing to you their appreciation for that good, hard, and important work. And we know the basic law of psychology is that behaviors that are positively reinforced are more likely to repeat themselves. So express gratitude, I imagine, is sustaining. My question for you, Rishi, is what else? What else makes a difference for you in rediscovering and re-energizing this really hard, depleting work?
Hmm. Any, I love that question, and yes, gratitude for sure is sustaining. I will also say what is incredibly inspiring and sustaining as well is seeing small acts of courage, um, because it's contagious, right? You see one person say something, you see one person stand up, and sometimes it's not a forceful march on the streets or some sort of assertive act. It's something as small as acknowledgement of concern or fear, this honesty to say this is hard and I'm hurting, or I'm taking care of those who are hurting. Just that openness and that vulnerability itself is courageous. Just to show that. That's contagious because it invites us, just like you did with this exercise at the beginning, to open up again, right? And I feel like that's one of the casualties that I've seen and really regretted, um, with some concern over the past year. It's seeing so many of us, including myself at times as well, close, retreat, get worry, get almost imprisoned by the uncertainty, and feel, in that act, feeling disconnected or isolated from others who I admire and respect and draw a source of hope from. So when somebody stands up and says, I'm just being open and honest about my experience, my truth, my concern, my fear, and more importantly, I'm not alone. I think we can do something about this. Man, that is an incredibly courageous act.
When you mention those words together in a sentence, small acts of courage and contagion, something inside me just starts to percolate. Like I can feel a rising energy. I can feel the contagion of that. I feel a new strength in the center of my chest. So thank you for naming those. And I just am with you, brother, right here in that shared sense of energize.
I love that. I wonder, Jeff, I want to turn that question to you too. I think that you are someone that I really admire for your ability to stay grounded, to remind yourself of kind of the things that nourish us, like help us remember what nourishes us. I'd like to turn that question to you about what sustains you, what nourishes you through this year.
Um, I have this idea, Sadhna, that my blood pressure is really important to keep in a low and normal range. And so I'm pretty fierce about not letting others and others' arguments get to me in a physiologically altering way. That doesn't mean I don't have courage and I don't have angry responses, but it means that it's a process of homeostasis that I want to monitor and manage as best as I can my own inner balance. So for me, that means not talking about the world unless there's something really terrible after 6 p.m. with my partner and my family. It means not having my phone in my bedroom, that my bedroom is a quiet place for me to reset and rejuvenate and renew. It means um, regularly attending to my physical body and my wellness, to find laughter, to find kind of uh, the tender embrace of friends and shared time together. Um, it's an intentionality, I think, Sadhna. I don't know if that makes sense.
No, that absolutely makes sense. Really caring for yourself, being observant of your own body and your own needs, and setting those boundaries. Sounds really beautiful and something
What's on your list,
I've
Sadhna? What are your best
I
practices?
mean, I definitely don't fiercely protect my blood pressure. I'll say that, which I love as a concept. Um, I do. I think that the what Rishi said about small acts of courage, similarly, I loved how you named that feeling because it had that same effect on me. And I was like, wow, it's so contagious that just talking about the idea of it feels energizing. And seeing what's in the chat here from folks about all of these wins and all of these ways that people are connecting are really have been key to my sustaining myself. I mentioned what's happening locally for me that I get to like feel in touch, but also through like the work that we've been doing at Health Begins. We set up this health equity policy hub, we have this mobilization network. And so consistently throughout this year, I've been able to engage with all of these folks locally who are so courageous and are so creative, and are problem solving in ways that they've never problem solved before, and are not kind of backing down from that as a barrier, or kind of letting themselves have actions happen to them or to their neighbors. And they're finding ways to resist. And I find that so inspiring. I don't know that this year would have been possible for me emotionally and mentally without consistently getting to be in those conversations with folks that were doing really inspiring work. I'm I'm wondering if we can call on some folks from the chat to kind of voice over what they've done. And so I don't know if let's see, if someone has a name, we can call them. There's so many good things in here. Maybe I'll ask Francis. I don't know, Francis from Bozeman, Montana. This feels a little bit like an old school radio show. Francis, I don't know if you're willing to unmute and kind of talk to us about the win you saw in Montana.
Yeah, hello. I'm Francis. I'm in Montana. I'm actually in Missoula, where I'm working with the tenants union here to kickstart right to counsel to protect renters facing evictions. But the right to counsel passed in Bozeman this past week, and it's the first of its kind in Montana, historically red state. Doesn't have a lot of leeway with wins like this, so it felt really big to have community members come together of all different ages and backgrounds, and yeah, it took a lot of work and really didn't seem like it was going to happen. Got a lot of backlash and will continue to, but I think it's a little ray of light in a dark moment.
Absolutely. I hope you saw all of the like applause exploding
Yeah,
for
yeah,
you
thank you.
and your team. That's a huge victory and hard one. And I'm sure with, as you mentioned, just a group of unlikely allies coming together
Yeah,
around something that's beautiful.
yeah, thank you.
Thank you so much for sharing that.
Then I'm wondering if we can go to Chelsea Cipriano, who I think has joined us as well. Chelsea, if you're willing, welcome your thoughts on this question. And hi.
Yeah, thank you so much, Rishi and Sadhana and all. This has been great. I just wanted to share a couple of reflections in from a space of, very non-partisan, work that still really gives me so much hope because it's focused on state and local health actions that are founded on collaboration and partnership. Our organization, the Common Health Coalition, is pretty squarely focused on this notion of better together, healthcare and public health working hand in hand to improve the health of Americans and how we can really improve these systems so that they work better for people. And I think that so many parts of the work that I'm so privileged to do and see in partnership with organizations like Health Begins and others is that when we ground the work in meeting people's needs, and just being really truly responsive and authentically responsive to what we're hearing from people that their needs are, whether it's people on the ground and patients and community members or health organizations who may be saying, hey, we're really confused about these vaccine policy changes. Like, what are we supposed to be telling people? What are we supposed to be doing at a state or local health department? The posture of just saying we're here to meet your needs is one of so much power. And when someone asks, why are we doing this? It's really nice to be able to say we're meeting needs. And so, we've seen so much amazing collaboration between community health worker organizations and hospitals and public health departments and payers and others who have come together to really just say, how can we better meet needs together? And that gives me a lot of hope that if we're rooting in that question, if we're rooting in that answer, that we are still doing right by the people we're serving, kind of in spite of, in response to everything that's happening, and bringing clarity and confidence to what people need right now from the health perspective. So I just wanted to share and reflect on that because I think often in many organizations, people feel um, like they can't take action or they can't be responsive to the needs at this time because of big P politics, little P politics, or otherwise. But I think that if what we are aiming to do is to just root it in meeting people's needs, that is a really grounding and driving element for me, at least personally, and where I've seen a lot of collaboration across red and blue states, regardless.
I love that,
I love
Chelsea.
that.
Thank you. One thing, just to give a plug, you mentioned the CHW organizations. I know that there's been at least 11 organizations that were given some support this past year through the Catalyst Awards. We'll welcome you to kind of put that information in the.
Yeah, no, thank you. Actually, the great raising that, Rishio. There were 11 organizations given some funding support from our organization to essentially uplift the work that they're doing and the important role that CHW organizations and CHWs themselves play, and how we can integrate CHWs and CHW organizations and programs as like that bridge between healthcare and public health. Because people, my grandma, my mom may not understand how public health and healthcare differ and why they don't work together. Like, we don't need to get into that. But they do know what the resulting end service feels like. It feels disconnected. It feels slow. It feels impersonal. And I think that the power of CHWs and the work that they have done for literally hundreds of years as a profession, is to make the impersonal personal, to make the frustrating possible, and to really bring that community perspective to patients and community members. And that's what we were trying to support and just really uplift that model. So thank you. If there are CHWs on CHW organizations, thank you, Rishi, for bringing that up, because that's what gives me hope. It gives me hope that there are organizations out there that are meeting needs in such a direct and authentic way, by people for the people they're serving. And I'm grateful for all of you. So thank you.
Thanks so much, Chelsea.
Yeah, I just want to voice over what I put in chat. That framing is really powerful, and I love that kind of prod to get us to think about the end result, which is what we're trying to meet people's needs, and that the way you put it, that it brings clarity and confidence to action is really beautiful. Thank you for that. I don't know if there's others from the chat that we want to pull up. We can, I think we have time for one more question among us. So why don't we go for one more question, which is, where would you urge this community to spend our time? So, we did a little bit of rest and reflection at the best. We honored some of the power of shared action and shared collective efforts. So now looking forward, the question is, where would you urge this community to invest our time, our attention, our efforts to solidarity right now and for the year ahead? So looking forward a bit. And we're going to pose that question in the chat. Thanks, Sam, for everybody, including us. And I'm wondering if I could go to you first, Jeff.
Good question. I'm thinking two different areas of my response. The first is social political change and the power and importance of vote, and getting out vote and talking with others about how we how we change things and march forward in the nation. Maybe related to that, I think a little more spicy is and something that I need and commit to working on in the year ahead is having difficult conversations with people with whom I really have such different worldviews.
Mhm.
So I hope that I'll be a better bridge builder, Sadhana, in the year ahead. I hope that I can do a better job of leading with curiosity and juicy questions and deep listening and really trying to put myself in another worldview and see if I can find some sense of comfort, commonality. I want to work on being less reactive or distancing or canceling. There's a lot of things that come really naturally. Sadhana, I hope in the year ahead I will be a bit better bridge builder. Rishi, where does this land for you?
I love that, Jeff. Yeah, I'm just processing what you're sharing here because that resonates. So I'll join you in your commitment if you want a buddy. I'll join you in that. I think just building on that, both those points, Jeff, and Sadhana, you and I have talked about this, and I know there's many on the line that I've talked to, and I'm sure this resonates with. I think this past year, if I think ahead to the next year, I think about this past year, and I think this past year reminded us that health equity, population health, public health, social determinants moving upstream, that these are not just technical disciplines that require rigor and skill and commitment. These are also democratic practices. And as we think to the year ahead, I think this coming year will continue to test whether we can strengthen the civic and the relational muscles needed to not only protect health, but democracy. And so these threats that we're facing are real. There's disinformation. There's real challenges to the integrity of institutions. There's communities that are being actively marginalized or scapegoated. Some with really, um, really concerning kind of language that clearly should worry us all about like the state of our democracy. Inequities are threatening to widen, especially with the implementation of certain laws that have just been passed this past year that threaten the health and access to food and just health coverage for so many. These threats are real. I think that for me, what I'd invite us all to kind of continue to think about is what the work of public health, of healthcare, of health equity, of social needs looks like, not just as a technical discipline where we can eke out some wins in this policy landscape, but what does it mean to do that work as democratic practice? How do we show that solidarity is a form of public health infrastructure? And how do we build those bridges with that goal in mind? That's a different project, and that's one that I want us to engage in. That's one that I personally will engage in. I know there's a lot of skills and muscles that we need to develop, and so I've been doing some real deep thinking on this about what kind of skills we need to build in the future. But that's my commitment and my hope.
I love that. I think what both of you said, we're kind of on that same path, right? Like Jeff started with the socio-political as well as the bridge building. And Rishi, that's where you're going as well, it feels like, right? Like that this bridge building, these skills that we're thinking of, not just for health equity, are actually in service of a greater kind of movement, which is in support of democracy. And so we have been thinking about that at Health Begins. We've, in the year ahead, I think that's part of what we'll be launching our skills that folks in the community need. It sounds like a number of folks on this call have it. They're in different ways in terms of the wins that we're seeing here. We could just flash on screen. I think it's in our slide deck, what we mean by some of these skills. So I don't know if Bobby, you're able to just like pull up our deck, and I think yeah, you can just click through these. I'm not going to go through them, but this is, I think, a bit of an example of like how to make some of these skills. They're not just happenstance, and it's a commitment is one part of it, but there's also something more structured for us to think through as a community about what we need to be able to build power consistently and how we need to make that commitment to ourselves and to each other. And so I love that. And I think this bridge building concept is so powerful because it came up in like Francis's comment with the unlikely allies within a red state that were values based and could still move forward because presumably the leaders that were building that moment could exercise these skills, as well as what Chelsea was saying with her values driven messaging, right? So I think there's something really beautiful here that we're looking forward to unpacking over the next year and thinking about how to like hone our skills and prepare better as a community for what's happening right now. Yeah, we can take down the slides. Thanks, Bobby. I think we are at time here. I see some beautiful things in the chat and resources in the chat as well. So I hope folks are looking at these resources that folks are sharing, as well as the stories. They're really beautiful. I think at this point, I'm turning it back to Jeff to take us to our end grounding exercise, and we'll leave a couple of minutes for Grace to come back on and close us out.
Thanks, Sadhna. I really like that slide about merging skills, and in particular, box number 7, which is adaptive and reflective practice. So let's do it. Let's go there. I'm going to invite you all to enter into the tunnels of reflection. So if you're comfortable to close your eyes or maybe cast your eyes downward. And maybe find your breath. Maybe let your jaw go slack and notice how that impacts the next breath. Noticing your inhalation and your exhalation, the gentle rise and fall of your chest. Just notice what it feels like to sit and have your body supported. Back, thighs, arms. If you can reach and have your feet sweetly grounded and on the floor below, notice that connection as well. Maybe pucker your lips and make your jaw really tight. And then let go and let the jaw fall. See if you can find those really sweet, delicious pauses in the breath cycle that we looked at earlier, that we felt earlier between inhalation and exhalation and inhalation anew. Find those pauses and crawl in real cozy. See how that lands for you. Sometimes when I'm going into those pauses between inhalation and exhalation, I like to find a mental image of a place where I feel warm and safe. I'll invite you to play with that as well. A real tangible place from your past or present where you feel nested, embraced. kind of melty, at peace. Notice your breath. Notice your jaw or anywhere else where you may be holding tension that you would like to douse with melty waters. When you're ready, flutter your eyes back open and come back into our shared space. Maybe you want to look up and down and gentle neck stretch, even perhaps over each shoulder, if that's calling to you. So what is my wish for all of us for the year ahead? Contagion of courage. Strong bridges built and enhanced. Warm-hearted celebration of each other and the shared delicious work that we do. A tethered and tighter embrace to hope, to possibility, to innovation and transformation. And that all of those things we can do together, arm in arm and shoulder to shoulder, because it is more powerful and it is far much more fun. Powerful and fun, which is how I might describe our last hour together. Thank you for including me, Sadhna, Rishi, all of you. And let me pass things back to you, Grace. Thank you.
Thank you, Jeff. Thank you, Rishi and Sadhana, and everyone who participated. It's a little hard to follow that with practicalities, or maybe it's easier than it would be otherwise. It could go either way. So, just a few things for everybody to know as we go on our separate ways. Thanks so much for all the insights and experiences you shared in the chat. We will be sending you a recording along with some resources that were shared here. Look to your email for that in case you want to touch base with anything that we discussed today. Again, you will see a survey pop up on your screen when we finish. We would really value any advice you can offer us there. And finally, this conversation is beginning, ongoing, constant. So let's continue it through Blue Sky and LinkedIn. And we wish you and your loved ones warm, safe, restful holidays. And we'll see you soon.
Thanks so much.